Medical interviews, particularly for core training, CT, and specialist training, ST positions, follow a structured format designed to assess specific skills and competencies. The interviewers aim to determine 3 key areas. 1. Competence. Do you have the right skills and experience? 2. Attitude. Do you have the enthusiasm, motivation, and drive for the specialty? 3. Fit. Will your personality allow you to work well with patients and colleagues in that specialty? Initial screening. Before the interview, your application form or CV will have been used to screen for essential and desirable criteria outlined in the person specifications on the MMC website. These criteria help shortlist candidates for the interview stage. Key documents for preparation. To excel in the interview, it's crucial to understand the criteria being tested. 2 essential documents provide this information. 1. The National Person Specification details the required skills and competencies for the position. 2. The GMC's Good Medical Practice sets out professional standards for doctors. National Person Specification. Each specialty has a specific National Person Specification detailing the selection criteria used by interviewers. Understanding these criteria is essential for tailoring your interview responses. Common criteria and how they are tested. 1. Clinical skills. Clinical knowledge and expertise. Knowledge base and application of clinical judgment. Ability to prioritize clinical needs and work to maximize safety. Tested through questions about managing difficult cases, prioritizing clinical needs, resolving clinical situations, analyzing test results, and demonstrating practical skills like suturing or intubation. Personal attributes. Aptitude for practical skills. Assessed through scenarios requiring manual dexterity and risk management understanding. 2. Academic research skills. Research and audit. Understanding of research, audit principles, and evidence-based practice. Evidence of participation in audit and relevant academic achievements. Tested by discussing research and audit experiences, explaining audit cycles, summarizing papers, understanding evidence-based medicine, and debating research in medical training. Teaching. Interest and experience in teaching. Assessed through questions about teaching experience and the efficacy of teaching methods. 3. Judgment under pressure, coping with pressure. Operating under pressure. Capacity to remain objective in high-pressure situations. Awareness of own limitations and when to ask for help. Tested by discussing stress management, examples of handling stress, mistakes made, seeking senior help, decision-making in changing environments, weaknesses, and dealing with criticism. 4. Communication skills, empathy, and sensitivity. Communication. Effective and sensitive communication. Ability to adapt language, build rapport, influence, and negotiate. Tested throughout the interview through role-play, presentations, or direct questions about communication scenarios. Empathy and sensitivity. Understanding others' perspectives and treating patients as people. Assessed through role-play, direct questions about handling conflicts, difficult colleagues or patients, and communication skills. 5. Problem-solving and decision-making. Logical and lateral thinking. Using logic to solve problems and make decisions. Flexibility in thinking and bringing a range of approaches to problem solving. Effective judgment. Tested through clinical questions, discussing difficult scenarios or professional dilemmas and examples of initiative. 6. Managing others, leadership, and team playing. Teamwork and leadership. Working effectively in a multidisciplinary team, demonstrating leadership and establishing good relations. Supervising junior staff. Assessed by discussing team playing and leadership examples, management experience, differences between management and leadership, delegation examples, and dealing with difficult situations at work. 7. Organization and planning. Time and information. Management. Managing, prioritizing time and workload effectively. Organizing ward rounds and understanding the impact of information systems. Relevant IT skills. Tested through questions about workload management, prioritizing tasks, organizing ward rounds or training sessions, and IT experience. 8. Vigilance and situational awareness. Monitoring and anticipating issues. Being alert to dangers or problems, particularly in clinical governance. Awareness of developing situations. Assess through examples of showing initiative, remaining vigilant, resolving unsafe situations, and handling complex clinical scenarios. GMC guidance, good medical practice. Sets out responsibilities of doctors towards society, patients, and colleagues. Essential reading before the interview as it crystallizes key concepts. Interview questions may test understanding of its principles through personal experience examples, theoretical questions, or discussing difficult scenarios. Other useful guidance: raising and acting on concerns about patient safety. Confidentiality. Consent, patients and doctors making decisions together. Conclusion. Preparing for a medical interview requires understanding and aligning your responses with the structured criteria set out in the National Person Specification and the GMC's Good Medical Practice. By doing so, you can demonstrate your competence, attitude, and fit for the specialty, ensuring a successful interview outcome.